Regarding the investigations for asthma, the best initial test is the peak expiratory flow rate. It decreases. The most accurate test is pulmonary function test. FEV1 by FVC ratio reduces. Chest X-ray may be normal, may show hyperinflated chest. Chest X-ray should be done to rule out pneumonia, pneumothorax, and congestive cardiac failure. PFT in asthma, FEV1 FVC ratio is reduced. Increase in the FEV1 more than 12% in 200 ml with the use of albuterol. Reduction in FEV1 of more than 20% with the use of methacholine. So improvement should be 12%, and then opposite of improvement should be 20%. ABG shows type 1 respiratory failure. Chronic bronchitis, two words, chronic and bronchitis, so it's type 2. Emphysema is one word, so type 1 respiratory failure. Asthma is one word, so type 1 respiratory failure. Methacholine challenge test, it is synthetic form of acetylcholine which causes bronchoconstriction in asthma. IgE level is increased in allergic cases. Management of chronic asthma, beta-2 adrenoreceptor agonists relax the bronchial smooth muscle, cyclic AMP, acting within minutes. Salbutamol is best given by inhalation, aerosol nebulizer, but may also be given per oral or IV. Long-acting inhaled beta-2 agonist, salmeterol, formoterol, can help nocturnal symptoms and reduce the morning dips. Stepwise treatment of asthma, inhaled SABA, which is short-acting beta-1 agonist, albuterol, berbuterol, levolbuterol. Add low-dose inhaled corticosteroid, beclomethasone, budesonide, fluticasone. Add LABA to SABA plus ICS, inhaled corticosteroid. Increase dose to maximum of ICS in addition to SABA and LABA. Add omalizumab. If still not controlled, add oral steroids. Alternative drugs, theophylline, leukotriene antagonist, Xylotone, so leukotriene modifier, Xylotone or zafirlukast, works best in atopic patients. Zafirlukast side effect is Churg-Strauss syndrome and hepatotoxicity. Side effect of inhaled corticosteroid is dysphonia, oral candidiasis. Salmeterol is not given in an acute attack. Side effects include tachyarrhythmias, hypokalemia, tremor, anxiety, paradoxical bronchospasm, salmeterol, tolerance, and arrhythmias can occur. So, tachyarrhythmia, tolerance, arrhythmia, anxiety, hypokalemia, so low potassium levels, tremors. So, tremors in the ECG and tremors for the person's hand. Tremor for the person's brain is anxiety. There's no seizure which occurs, but hypokalemia occurs, low potassium levels. Paradoxical bronchospasm, so bronchodilator causing bronchospasm, that is salmeterol. Salmeterol is not given in an acute attack. Corticosteroids reduce the bronchial mucosal inflammation. Aminophylline metabolized to theophylline act by inhibiting the phosphodiesterase, thus it reduces the bronchoconstriction by increasing the CAMP levels. Anticholinergic agents, ipratropium and tiotropium, reduce the muscle spasm. Chromoglycate is used as prophylaxis in mild and exercise-induced asthma, always inhaled, especially in children. Leukotriene receptor antagonists such as montelukast, zafirlukast used in chronic cases. They are not effective in acute attack. Leukotriene receptor antagonist, montelukast and zafirlukast. Recent advances are there. Mepolizumab and Reslizumab are humanized MAB monoclonal antibody used for the treatment of severe eosinophilic asthma. They are IL-5 antagonist, interleukin-5 antagonist. Benralizumab is a monoclonal antibody used for the treatment of asthma. It is a IL-5 receptor antagonist, CD125. So that was about the investigation and treatment for asthma. So quick recap. Investigations, peak expiratory flow, PFT, chest X-ray, ABG, methacholine challenge test, IgA level. Management, SABA, LABA, inhaled steroid, theophylline, aminophylline, omalizumab, leukotriene modifier,